This is an educational tape made primarily for my soldiers at Fort Lee, Virginia. In the event, however, that other soldiers see it, I identify myself here as Dr. Robert S. Brown, a psychiatrist who's been treating soldiers returning from and entering into combat in our 2 wars for the last 7 years. And what I'm going to talk about today is the form of treatment that I've been using at Fort Lee, different from other recommended forms of treatment, though I use those forms as well. And I want to explain it so the soldiers who see this can see what the background is that I'm trying to build this theory on, this treatment on, and explain to you that it involves the development of the sense of trust, which I think is one of the major issues in PTSD. I want my soldiers to learn how to trust themselves, to trust their environment, and to trust other people that are important to them. The most important question is, where does the sense of trust come from in the very first place? To answer that question, I think we have to take a look at child development. Some of this may sound far-fetched to you, but it is what is called evidence-based understanding of early child development. As a result of this review, I want you to come away with an understanding of how children learn to trust and how you might be able to recapture some of that method yourself to relearn trusting that was just damaged or destroyed almost completely as a result of combat. According to Melanie Klein, a 20th century woman psychoanalyst in Europe, the first sense of reality that any child develops is the distinction between the good breast and the bad breast. The good breast is the one that is present to the hungry infant when it needs it, and the bad breast is the one that is not present when the infant is hungry. That is the first step in learning the separation that the child will have to learn to deal with between itself and its mother. This first sense of self is the first. I've just talked about the sense of reality there. The next is the development of the sense of self. And that's based on the mothering person loving the child at the same time the child is being fed or changed or comforted in some important way. In this sense, the mother is a master sculptor. By loving the child, touching its body, the child gets an image in its mind of the body. We refer to that as the body image. So the first sense of oneself is the sense of one's body. This is important because in trauma, the sense of one's body is often changing and sometimes threatening in its changes. So this sense of reality first, then the sense of one's body, and the sense of reality preceding both of those. What comes next, and is most important to the treatment of PTSD, is the sense of security or trust. This requires the child to be treated in a consistent, predictable manner over a period of months. So what the child comes to expect is what the child actually learns to experience. No real surprises for early childhood, and if it is, it comes at the cost of some sense of loss to the child. Now, the sense of security that the child develops is based entirely upon the memories that come from the mothering person that the child is an acceptable, lovable person with an acceptable, lovable body, with an acceptable understanding of the difference between itself and its environment. This nurturing occurs in such a way, at such a closeness, that it's been called normal symbiosis. The mother and the infant are so close together during these early stages that they function as one unit. And then the next stage is called the separation phase, where the child is able to crawl away from the mothering person, but communicates through oohs and ahs, but is going away only with the consent of the mothering person and with the memory of the mothering person, sometimes with objects from the mothering person, such as a blanket or a toy or something that keeps them in touch with all of the biological characteristics of the mother, the smell, the touch, the warmth, those kinds of things. With that, the child moves physically and emotionally into its own sense of self, now being strengthened into the final stage that's called individuation. At this point, the child becomes a true individual. Now, I personally believe that every relationship goes through these stages. If you think of the most recent romantic relationship you've had, at first you were indifferent to this person until something important happened between you. This has been called the smile of recognition. When the mother's eyes and the child's eyes meet in a significant way, that introduces the stage we call normal symbiosis. And then the next stage of the relationship, I'm now having you review your last romantic relationship. You and this other person function as one unit, could hardly stand being away from each other. And things that happened in that stage, if they're successful and pleasant, you can remember them enough so that you can separate out and then become an individual again and love each other on a much more mature plane. Many relationships get stuck in this normal symbiosis. And for one reason or another, usually because of some insecure form of attachment, one party or both are unable to tolerate the separation. And then mistrust comes in, lack of security comes in, and the relationship is doomed. Now, I'm going to ask you now to think about your last traumatic experience in combat. The reason these stages are successful in the child's development is because there's a meaningful relationship between the mothering person and the infant. The reason you were able to survive and function optimally is because you were able to become attached to your fellow soldiers. The Army is built entirely upon attachment theory. Attachment theory means that feelings develop between people that lead to closeness, that lead to mutual respect, and lead to a repetition of those early experiences of a sense of security. Now, some soldiers come into the Army with a poor sense of themselves. They often come from insecure attachments in childhood, where there was a lot of anxiety or avoidance. But interestingly, in the Army, through the training and certainly through the missions of combat, a very close relationship develops between soldiers. And when you come back, most soldiers tell me that they would rather be back in combat, not really knowing why, but I think it's because there they felt secure with the attachment of people on the left and on the right that could help defend them. So, what kind of therapy would be most advantageous to help restore this sense of security? I think it requires therapy that in many ways repeats the early development of childhood. The therapist has to become a mothering kind of person. The therapist has to be a person that is predictable, consistent, has no surprises for you. And you develop, and you know right away, even a dog can tell right away if a person likes them or not. You can tell right away whether your therapist is interested in you as a person and whether you can relate to that person in a trusting manner. I myself, I believe, have, I would say, stumbled into this or perhaps been divinely guided into this. But I set up my office so that around me are maps of Iraq and Afghanistan. When I see a new soldier that appears to have all the symptoms of post-traumatic stress disorder, and I don't have to tell you what that is, but it's one of the worst, most horrible feelings a person can have, because there's no sense of security, no sense of trust. And There's no way to relax and no way to have meaningful relationships with your family who don't understand you, your friends and don't understand you. Everyone is telling you you're different. You come into an office of a therapist you can trust. Stand up at the map and show where you've been. Tell your trauma story in such a way that the person that you're talking to is listening. And then you feel like you're being understood. To be understood is to be immediately comforted. My purpose is to help you find a way of feeling comforted as the first step. The second several steps have to do with having you develop a sense of trust and security in the relationship with your therapist and later with others around you. This is all done in the context of a trusting environment, in the context of attachment. So when I'm convinced that the soldier in front of me has post-traumatic stress disorder, has not been treated before, is willing at last to submit him or herself to treatment, then I, like most therapists, will thank them for serving. But I also, from my heart, say, I feel that I'm on sacred ground when I'm speaking with you and hearing you tell your trauma story. Inevitably, this is followed by a period of silence, where the soldier is looking into my eyes in the same way that the infant looks into the mothering person's eyes, not with a smile of recognition, but a form of recognition that here is someone at last who understands me and I can trust. And then I take out my professional card and put my cell phone number on the back of it. And also from my heart I say, you have put your life on the line for me and others in this country. I'm putting myself on the line for you. I'm making myself available to you with all the skills that I have developed and been privileged to learn about, and with all the knowledge that I've learned and been taught by other soldiers for you on a almost around-the-clock basis. When I first went to work, I said around the clock. And you can call me anytime around the clock. And only once or twice did I get a phone call that was inappropriate, probably based on maybe a fear or a misunderstanding. But I might get a phone call like at 3 o'clock in the morning saying, Dr. Brown, I hate to bother you, but I'm going to be 10 minutes late for therapy tomorrow morning. I don't need to know that at 3 o'clock in the morning. So now I make it fairly clear that my cell phone will be on and available to them from 6 in the morning until 10 at night. Now, this is sometimes tested, which is understandable, but I wear the same kind of clothing every day. I have the same tone of voice as much as I can every day. I make it clear that whatever it is they need, I'm going to do my best to provide it for them. I can say that almost without exception, this has worked highly significantly. So the soldier knows that they have a kind of a mothering person substitute for them to help bring them back to a sense of reality and a sense of themselves and a sense of trust that they can respect. Now, this is followed by the next stage of development of any relationship and any of the important development of early childhood by the separation phase. So with the soldier's consent, I move them soon into a group therapy setting. We have 7 different kinds of groups in which other soldiers, all of whom have been in combat, meet once a week for an hour and a half, or more often in groups for an hour and a half, and they learn to talk to each other. This is a highly unstructured session. We don't have any agendas. They come in and they feel comfortable immediately because these are other soldiers, same kind of soldiers who've been through what they've been through, and they can understand. The following and final step of this is when we reach the termination phase. Some soldiers will have to go through a medical board, some will retire, some will be transferred to another post, but they know they can always come back to the group as long as they live. They know they can always contact me as long as I'm around. I am pleased to say that this has been a successful form of attachment therapy for hundreds of soldiers. And I believe it can work for you. And I believe it works best if you come in and honestly put your cards on the table. There's nothing that you need to hide. Nothing needs to be undisclosed, because I'm not there to judge. I'm only there to help you understand yourself and to run interference for you as if you were on a football team. Now, let me review what I'm talking about in the most simple terms that I can come up with. You were not raised to be someone that would experience the kind of trauma that you've had to see. No person in our society has ever sacrificed women and children for the sake of an irrational religious belief, who views them as targets. No one in our history has blown up human beings like our enemies have. No one has seen a fellow soldier vaporized by an RPG, or a truck blown 25 feet into the air, or to see what you have seen. I don't have to go through all the bad things you've seen, but I want to tell you that it would be extremely abnormal to come back and be unaffected by what you've seen, by what you've smelled, by what you've touched, by what you've heard, by what you've tasted. So this is an approach to help you become normal again after being in a most abnormal set of circumstances that has ever occurred in the history of the world, as far as we know. At no time in history have explosives been developed to the point they have been developed today. At no time in history have thoughtless, heartless, careless people gone out of their way to destroy you, our country, and you and your friends and family. But we can defeat this kind of terrorism by recovering our sense of self, our sense of trust, our sense of reality, knowing that we are in the right, knowing that we have gone over there and done wonderful things. The media has not been fair to us as soldiers. One soldier told me he was in a helicopter, the whole purpose of which was to push out soccer balls and teddy bears. And they were being shot at by the enemy from all directions. They put their life on the line to give toys to the Iraqi children to play with, and later saw them playing with the soccer balls. So what we've done, I think, has been what is called a humanitarian effort, unappreciated by those that we've tried to help, misunderstood by the world, and you come home to a family or to a nation that doesn't understand you. I think you're all heroes. I want you to learn to live as heroes and learn to respect yourself in the same way that I respect you.